Well, here we go again. Dr. Bob here, and we're going to finish up with the chronic diseases. It's been a while. I'm at a new venue. I got through a busy summer. Fishing Lodge was very amazing. I think I flew about 100 days in my de Havilland Beaver, guiding people to various activities on the South Central Alaska region, Kenai Peninsula, flights over the Harding Ice Field, fishing at amazing places, ptarmigan hunting, glacier viewing, bear encounters, everything. It was great. It takes a lot of stamina to get through a long season like that. Didn't do much content development during that 4-month period from June through September. Most days I was up at 5:30 getting weather so I could fly safely or know whether I was going to be flying. Had a few cancellations, as you might expect, and a lot of times my activities with the lodge wouldn't finish till after 9 o'clock at night. I'm currently in a different location than my medical office. I'm on my feel like well-deserved vacation here in Montana. This is the very room where I actually lived for about a quarter of my life the last 5 years, as I put myself out to pasture, leaving a busy emergency room and working in a small hospital here in the town of Sydney. This was my apartment that the hospital would put us up in, and this was actually the room I would always have, 3rd floor, so I could walk up and down the stairs as much as possible, something we'll talk about when we discuss strategies for obesity and increasing energy out. That little bit of rustling you heard behind me is my dog Maverick. I'm here hunting birds and not working anymore. I completely retired from emergency medicine, and we'll talk about that at some point in the future and all the ins and outs of why that occurred. So anyways, the last time I sat on that couch and videoed, you can probably have access to that YouTube video. It was when I contracted the alpha version of COVID early in the pandemic. I happened to be arriving here in October of 2020, peak of the pandemic striking this particular region of Montana. It was one of the darkest colored counties, and the hospital had put together some makeshift negative pressure rooms, and I was taking care of really sick people and socially isolating in between shifts. Caught the virus, and you can watch that video. It didn't have a huge effect on me, and largely probably due to the fact that I am in superior health because I practice what I preach, which I will be preaching to you at length after we finish covering chronic disease. Okay, well, what's left for chronic disease? I mean, we've talked about cardiovascular diseases, coronary artery disease, cerebrovascular accidents, microvascular dysfunction causing destruction of your organs as your blood supply to them diminishes over time as we age. We kind of went off into hypertension as a sub-disease of the cardiovascular system. We talked about arrhythmias, which are abnormal heart rhythms. We talked about the condition of congestive heart failure and some of its causes. We had to talk about blood clots in the legs and lungs. And then we moved on to diseases that are not specifically of the vascular system, and cancer being probably one of the more prominent ones in all of our minds, because we know that it's probably, after cardiovascular diseases, it's probably the next most common cause of death. From there, we moved to the metabolic diseases like diabetes, discuss the difference between type 1, which is kind of more of an unfortunate genetic predicament, versus type 2, which is a combination of genetics and your behavior. Had to talk at length about dementia, which we covered in some detail. And then we moved on to obesity and talked about some of the causes and some of the negative effects beyond which is not a significant affect the cosmetic issue. We move to autoimmune diseases, diseases which are largely caused by overactive immune system, which can be lifestyle enhanced or reduced. And I think diet is a huge implication there. Moved into diseases of the lungs, chronic obstructive pulmonary disease, asthma, those sort of things. And then talked about what sort of things we could have happen to our kidneys and genitourinary system. And then finally discussed the gastrointestinal system, liver, pancreas, stomach, intestines, and hopefully I gave you a good overview. So let's say you strum along through life, you dodge all the above bullets. You stayed ideal body weight, you stumbled onto a diet that didn't cause you to overeat, you stayed active enough that you didn't develop any of the cardiovascular diseases, and you were fortunate you never got cancer, didn't have an accident, infection, you didn't really get metabolically ill. What's going to get you? Well, most of us would say old age, but what old age actually is a diagnosis called frailty. It's where we're all headed. Frailty will eventually result in a condition where a human being is no longer to carry on the activities of daily living independently. Once you are unable to stand up from a chair independently without help, you're probably headed to that place that none of us want to ever be at or have one of our loved ones be there, which is nursing home. In fact, if you went into the nursing home in any county today, you would see a high percentage of elderly, thin females because they tend to live long and they become frail. I mean, women have a greater risk of frailty than men, having less testosterone and inherently less muscle mass. So, frailty, which is somewhat due to decrease in muscle mass, a term we call sarcopenia. Sarco is muscle, penia is small or diminished. Again, not a cosmetic issue. Muscles, and mine are quite small right now from a 4-month hiatus from resistance training, are not something to enhance your cosmetic appearance. They are disease-reducing entities all by themselves. I will share with you in the exercise portion of our strategies that we will cover in great detail in the future a lot of scientific evidence that shows that muscles reduce cancer risk, lower blood pressure, improve cardiovascular health, and obviously muscles reduce frailty. The only way you are going to prevent frailty, particularly as you get older, is if you train to prevent it. Now, what are one of the other conditions that frailty is associated with that we haven't covered yet, which is osteopenia and osteoporosis. Now, these are two terms that refer to a weakening of the skeletal system, and they are associated with aging and a decline in our hormones, poor lifestyle, and actually with being at ideal body weight. One thing that obesity can protect you from is osteopenia and osteoporosis. Now, before we drill down on those two terms, I do want to point out that obesity is not a strategy for protecting your bones. Obesity, as we mentioned earlier, will destroy your bones at the joint level. They will disrupt the cartilage from wear and tear and excessive stress, and people who are overweight will end up replacing their joints at a younger age than those that are ideal body weight. But they are less likely to develop low bone density because that mass is a stimulus for the bone-creating cells in our body to make strong bone. Okay, osteopenia and osteoporosis. I will share with you the diagram that sits behind me on my office wall because I constantly assess my patients for their bone density at every annual through a process called DEXA scan. We'll discuss in more detail when we get to biofeedback markers. But anyways, I measure bone density and I give my patients a T-score. And as you can see on the diagram, a T-score is basically where you fall on the bell curve compared to healthy 20-year-old females, and it's based on how many standard deviations below the average. So a T-score of -1 means that your bone density is 1 standard deviation below the bone density of a healthy 20-year-old female. Osteoporosis, which we term as brittle bones, compared to osteopenia, which is weakened bones, is when your bone density is 2.5 standard deviations below that of an average healthy 20-year-old female. So at any rate, these two diagnoses are serious diagnoses associated with the aging process that indicate the development of frailty and weakening of the skeletal system. Obviously, as these occur, the likelihood of fracture increases with falls. This happens to coincide with the time when people's, neuromuscular system is not as agile as it once was, and they're more likely to fall, and fractures are a major debilitating factor in the aging process. For example, the average 65-year-old person who falls and breaks a hip has a 1-year survival of about 60%. Somewhere between 30 and 40% of those people will be dead in a year just from the aftermath of the fracture. So we definitely don't want to let our bones get frail, and we have strategies for that. Lifestyle, hormone replacement are the mainstays. There are pharmaceutical agents. They have a high level of side effects and are not recommended by this clinician except in the most extreme cases. Back to the muscles. Muscles are important too. You need strength to carry on the activities of daily living. Those muscles will protect you from all kinds of ravages. For example, if you ever are particularly ill from some other condition, let's say you get a bad infection or you're involved in a serious trauma and you're hospitalized, your muscle mass is the amino acid sink that your body has to utilize for tissue repair and regeneration. So you're fighting the battle of your life, you're fighting off some terrible infection, you're fighting off some trauma, trying to heal damaged tissue, and you have no muscle mass. Ironically, they don't feed people very quickly when they're unable to feed themselves in a hospitalized setting. It's usually about several days before they start to use feedings through the gastrointestinal system via tubes, and sometimes people are not well enough to digest food and they start to feed people through their veins. Usually they don't start that for as long as a week. So you have to have reserve, and that's what your muscle mass provides you in the setting of a high stress situation like a hospitalization. Obviously, your muscle mass will help you to carry a suitcase up the stairs and will help you to get up from the seated position so you can carry on the activities of daily living in your home for as long as possible. So it is very important to strategize against frailty. Fitness, muscle mass, balance, all of these things are so important to our health. And one of the things that I'm going to help you to do is to come up with a strategy, a lifestyle, a vision for your future that puts you in a place where you're less likely to develop these things. For example, for the last week, I've been hiking in the uplands with my dog, and my wife and son were here, and I have another week to do so. The month of September, I guided ptarmigan hunts. I have developed a lifestyle where it changes from month to month, but I always have some strategy for maintaining activity, cardiovascular fitness, and some form of resistance training. Now, I do less resistance training in the summer because I'm physically so busy, so I lose some muscle mass. I'm probably 8 to 10 pounds lighter of muscle right now in October than I will be when May rolls around at the end of my resistance training season. But anyways, you can see from this screenshot of my iPhone cardiovascular health monitoring system, how many miles I've walked, how many steps I've taken just in this last week, because I went out and walked behind a dog and chased birds, something I love to do, which is free exercise. A strategy for free exercise we will talk about in great depth, and when we get to lifestyle and exercise. So anyways, frailty, it's a thing. It's what fills the nursing homes in this country. It's a risk for fracture. It increases the sarcopenia associated with frailty, increases your risk of cancer, cardiovascular diseases. Muscularity is as important as fitness. So we definitely need to be keeping that in mind. And I promise you, if you stick with me, I will teach you what you need to know. I will give you the motivation to apply what I teach you, and you can expect success. Thanks a lot for listening. We'll talk to you very soon, where we will now pick up to going back to the blood vessels in a little more detail and talk about what drives that vascular disease, since it is the number one cause of mortality pretty much in the human race. Thanks again.